I'm coming to you from New York City after having met with Dr. Rozbruch at the hospital for special surgery at the limb lengthening and reconstruction service or clinic. I had to wait for several hours to see him, meet with him. My appointment was at 2, and I think it might have been about 4:40 before I actually got to see him. I had to go get some x-rays, and that took a little bit of time because of the dysfunction in my leg. But in any event, I had a good visit with him. It's been several years since I've seen him. He did remember my case and remembered Dr. Brian Kelly referring me to him for assistance with my case. He made several comments about that my leg had certainly progressed in a negative fashion, although I had maintained a good body status. You know, I looked healthy, it seemed healthy, hadn't picked up a lot of weight, things like that. So he was very impressed by my maintaining my level of health despite the condition of my leg. And we discussed a bunch of different things after he did an evaluation of my leg. And ultimately, you know, he proposed taking my leg, saying that he thought that that would be something that, number one, he could do, and number two, that he thought would help reduce my pain. The integration aspect of an amputation for this is cutting edge. There's only 3 or 4 other people that he's aware of that have undergone osseous integration for a hemipelvic amputation. So that's not honestly very thrilling to me to be number 4 or 5. However, he did say that given my determination and my ability to maintain my health, he thought I'd be a perfect candidate. He thought I'd be a perfect candidate for reducing pain. He didn't use the word eliminate, but he thought that it could be almost non-existent was his word. Certainly improving my general health will be achieved with amputating my leg, because then I'll be able to sit upright, not have to sit crooked. I'd be able to bear weight on both legs, to take some weight or unload my left leg some, which I can't do now. But there's still a host of questions, and there's going to be some questions unanswerable because there's so few people that have undergone this, and there is no studies for long-term implications. Again, that's not thrilling. It's not like they've been doing this for 10 years. So that is really scary. Above the knee amputations and below the knee amputations are much, much more common, and they have a lot of studies for that that type of amputation. There are hemipelvic amputees, but not with osseous integration. And if you're unfamiliar with osseous integration, it is a rod that basically your bone grows into, and so it kind of becomes an extension of you, this metal rod. And the metal rod connects to a prosthetic. And in my case, it would be a prosthetic that would have a hip joint, a knee joint, and an ankle joint. So most people have a knee joint, ankle joint, not 3. So 3 joints in any type of prosthetic is a challenge. Doable, but a challenge. So for me, how much do I give up? How much do I gain? I don't think that it'll be a clear-cut answer. And I think some of it will have to be on faith if I decide to go that direction. and faith if I decide to wait. So I'll be doing a lot of praying and a lot of thinking. I have some scans to have done to determine my level of bone in my pelvis, because there is this thing called osteopenia, which is when your bone thins due to not being able to weight bear. Osteoporosis is just a natural thing for a lot of women. They lose bone over time because they don't have as much calcium. Mine is because of the lack of ability to stand on it. I also would like to meet with a prosthetist, somebody who makes prosthetics, to discuss what that would look like and what's available for functionality purposes. Dr. Rozbruch is going to speak with a surgeon that he is personal friends with that has done this in other patients. He told me that he would be working with him. If I decide to go in this direction, he'd be working directly with him to help me in the treatment process of this. He also communicated that he would like to get me in touch with somebody who has had a hemipelvic amputation, which is an amputation of the hip on down, so that I can have a conversation with them, or conversations, so that we can have a dialogue and I could gain some insight to what that looks like. So I did speak with one of his colleagues who is in training. He is a full-fledged physician. However, he worked with the gentleman that Dr. Rozbruch is personal friends with. It's a physician in Australia, and he spoke with me at length about his experience with that surgeon and his time there, and how he felt, again, that I was a great candidate for this procedure, and he thought the outcome would be great. So I'm happy to have two people that think that it would be great, and they don't have any reservation, quite frankly. So I have to decide, once I speak with other folks, if it's something that I would choose to do, or if I'll choose to wait, or I just will choose not to do it at all. So as I journey through this, I'm going to be praying, I'm going to be asking questions, and I'll keep you updated with what I find out, because I think it's important to share for anybody else that may be faced with a decision like this. All right, until then, I hope you have a blessed evening. Take care.